Hey, Shannon.
Alrighty, just give me 1 second and we will get ready to roll. Someone else is joining.
Okay, give it a second.
Okay. All right, Eric, the floor is all yours.
Thank you, Shannon. Good afternoon, everyone. Thank you for coming into the briefing this afternoon on COVID. Wanted to make sure that we kept the community apprised of really what's going on and the possibility of what could happen in the next couple of weeks to months. Answer any of your questions you might have. But again, just mainly to make sure that we do our due diligence by, again, making sure that the community is updated on what is happening with COVID, not only cases, but vaccinations. So Shannon, could you go ahead and flip our slide? Wanted to make sure that we kind of broke this down into age groups so that everybody has an idea of the questions that we continues to get is, really who is getting sick with COVID. Prior to today, you see that those ages 0 to 19, a little bit over 18% of the cases are in that age group, 20, 29, 27, 30 to 39, 19, 40 to 49, 14, 50 to 59, 11. And then as we get up into those age groups of 60 plus, you see that it really does decrease in the percentage of those who have coming down with COVID. Please remember too that those age groups, we do have close to 70 or over 70% of those age groups have been vaccinated. So the idea here is just wanted to make sure that you saw right now where we are at. 0 to 11, and just break down this a little bit further. We had 13 of those 116 cases from 0 to 11, which is about 11.2%. And then 12 to 19, we had 8. So it's about 6.9%. Just gives you an idea of where we're at right now. Shannon, next slide, please. We've talked a little bit about where we've been over the last couple of weeks, and we've been doing great. You can definitely see that the numbers have been running very low, between 2, 3 to 8. But the problem right now is that you kind of see where we're at over the last week or so. We've seen an uptick, and it's a little bit of an anomaly right now from what we had over the last couple of weeks. Now we're still trending average low. 6.5% over the last 14 days, but the prior 14 we were 4.29. And again, the idea here is wanted to make sure that that we're showing that there is an increase, even though there's a slight increase, we're seeing an increase. And if we look at what's going on in Ohio, we're kind of matching that as well too, as we're starting to see this uptick. Shannon, next slide, please. Thank you. Where are we at with our vaccine? Right now, we have a little over 204,000 individuals that have started the vaccine, which really equates to about 47.77% of those in Lucas County who have got vaccinated. Again, this is good, but it's not close to that 70% where I think that magical number is where we want to be. But again, we are doing relatively well getting vaccinated. The problem is, we're seeing very slight vaccines on a daily basis. There might be a change of 50 to 150 individuals who've gotten vaccinated. In other words, from yesterday to today, we could see maybe 50 individuals to 150 individuals, where at one point in time, we were seeing thousands of individuals from day to day getting vaccinated. And I really want to make sure that we understand, next slide, please, Shannon, that vaccinations are extremely important. And in the fight against the Delta variant. I mean, please remember, the Delta variant is the hot variant right now, where they're looking at it being much more infectious than the variants we've had before. They're saying 60% increase in the ability for it to be infectious for those individuals in a community. What we are seeing is there's a great deal of those individuals who are not vaccinated, who are showing up either being positive and or showing up to the hospitals. We're hearing over 90% of those that are reporting to hospitals and who are having COVID symptoms or are positive for COVID are those who are unvaccinated. So that's why it is extremely important, again, to make sure that we're getting the word out about vaccinations. And there are ample ability to get vaccinated. This is our this week's schedule for vaccination clinics. We do set these up every week, so you can find these on Facebook. But we will continue to offer vaccination clinics as we move into the coming weeks and months. Shannon, next slide. The real issue that we want to talk about today, I think, is what is the possibility of going to occur in Lucas County or in Ohio. As I said, we are seeing an uptick in cases. Again, it's not great, but if we're comparing ourselves to other communities in the United States, which are having significant issues with the Delta variant and COVID, not just those that are, again, coming down with COVID and testing positive, but I think we're seeing those stories of those hospitals becoming inundated again with COVID patients, whether they're being admitted into the hospital in the ICU or vent use. They definitely are seeing issues in other parts of the country. We are right now not seeing that. Our hospitals are in very good shape. Just took a look at some of the numbers this morning, and vent use in Lucas County, as well as those admits for COVID, are low. Right now, we're in good shape. But again, if we're looking at the trend from other portions of the country, what is the possibility of us having the same issues? Our vaccination rate, as I said, isn't too bad at 47.77%. How is that going to affect our ability, again, to not have the variant spread as easily as some of the other communities? Some of those other communities are very low in vaccination rates in the 30s. And we just don't know. That is why I think what we're going to try to do is really urge individuals to get vaccinated. I know there's been incentive programs out that we're going to be looking at incentive programs in the future here, in the near future. Again, hopefully maybe disperse some of those individuals that are on the fence about getting vaccinated. And again, we do know that those individuals who are reporting to the hospitals and coming down with COVID and serious symptoms are those that have not been vaccinated. The schools, I know that that is going to be a big topic here in the very near future. Actually, last week we had a conference call, a Zoom call with our school systems in Lucas County, talking about mask use and recommendations and COVID vaccinations. Want to tell you right now that the Ohio Department of Health has not issued any guidance yet. We just got off a conference call with the Ohio Department of Health here a little over an hour and a half ago or so. And they are revisiting their guidance, and they're hoping to get that out in the next couple of days. Why are they revisiting it? Because of the most recent recommendations by the American Pediatrics as well as the CDC about when to wear masks and how to wear masks. CDC has said that anybody who's unvaccinated 2 and above should be wearing a mask when they're inside, especially. The pediatrics have said that anybody who is in school should be wearing a mask if possible, including staff members. So there is some differing opinion about when to use masks, especially in the schools. And again, I'm hoping that the Ohio Department of Health by the end of the week will have guidance for us. So Shannon, I think I really wanted to keep this relatively short to make sure that we were succinct with our message. Again, we don't know where we're going to be in the next couple of weeks with cases. So if we're looking at trending, there is definitely the concern that we're going to see increased cases, which then means we'll have increased hospital visits. And unfortunately, as we've seen in the past, lagging behind that is the fatalities from COVID. We don't have a crystal ball, so we really can't tell where we're going to be at. But again, it really is up to us as individuals to protect our families, our friends, and our community the best we can, and making those good decisions about getting vaccinated and when to wear a mask. So Shannon, I'll open up for questions.
Sure. Members of the media, if you have a question, please raise your hand and I will call on you, and then you can certainly unmute yourself and turn on your video if you'd like. First question comes from Jaden Jefferson. Jaden, go ahead and ask your question.
So Governor Mike DeWine recently announced that he's working on a second vaccine incentive. Have you been in contact with him at all, or have other health departments been in contact with him about that program and what we can expect from it?
Yeah, we don't know any details. I will let the community know that we do speak with the governor's office as health commissioners every week. I think I've mentioned that before, but that is just something that I think is good to know, that the communication is wide open. But again, I haven't received any real details on how that is going to look.
Okay, next question is Bree. Bree, go ahead and ask your question.
Thank you so much, Shannon. Quick question, Eric. So what, I guess, exactly are the local hospital systems doing to prepare if we are going to get to that, if it's going to trend that way that we do get to them being inundated? What preparations are they making? Again, is it similar to what we saw during the peak, however many months ago?
Bree, we're real lucky. Our hospital systems here are just second to none. They've been prepared again for any type of surge. The idea here is where the resources. I think we're much better off than we were definitely a year ago with resources, whether that's N95s or other equipment that are needed. Staffing is always an issue right now for not just our hospitals, but I think across the state and across the country relative to those medical professionals. So that probably is a concern for everybody as we move into any type of surge. But again, our hospitals have continuously been prepared for another wave. It is that unknown, I think, that all of us have a concern with. Especially the hospitals, what is it going to look like? How many patients might we have? What is it? And what is it going to look like when it does happen? Much like we did over a year ago, we've been through the fire now a couple of times with these different surges and waves. So we kind of know what to expect, but we don't know exactly what it's going to look like. So we have to prepare for everything we possibly can. And our hospitals are doing that.
Next question is from Andrew Osmus. Andrew, go ahead and ask your question.
Yeah, Eric, you sort of mentioned how we've been through, more than a year now of these waves, and it sort of seems data-wise that it's following a similar trend from last summer where it dipped in June. We got past July 4th, and then numbers started to creep up, and then they went up pretty significantly. Are you concerned we will see another significant sort of climb? Probably not as high as last year because we have the vaccine now, but still, it's last summer around this time was when stuff started to ramp up.
We're lucky right now that we can go out and about, and we really don't have any of those restrictions we had last year. And so what I think where we're going to see is because we're out and about, and we're probably a little bit less enthusiastic about wearing masks and washing our hands. That's going to probably add into any issues we might have. I think, again, looking into the crystal ball that I really don't have, I do believe that we are going to see a trend up. I think we're seeing something similar we've seen in the past waves. The graph that I showed you before, the anomalies, the little spikes here and there. Remember how this disease works. Let's say a 2-week lag time on cases, because again, how you become infected with it. So the numbers that I'm looking at right now, again, just a gut feeling of where we're at, and looking at where other individuals are at in the country, we are probably going to see some type of increase. But I think you're 100% right. I do believe that the amount of vaccine that we do have out, vaccinated individuals we have out there, will cause a barrier to a spread. But how much of that barrier is going to be up, and what does that look like when we're a month or two from now? Don't forget too, we're moving into eventually here in the fall, where we're going to start bringing people close together. We've got school coming up. Again, I keep on saying this. We're going to have to live with this COVID. It's here. It's going to stay here. It's not moving any place fast out of our lives. So we're going to have to figure out how to react to each thing that this does to our community, whether it's in our schools, in our, in our businesses, with the understanding that, I'm not so sure that lockdowns, restrictions like we had a year ago, probably going to return to any community in Ohio. But again, that's going to be up to the governor and the Ohio Department of Health.
I was going to ask, you mentioned about restrictions. I think any sort of a mask mandate is out of the governor's hands. I think the state legislature took care of that, but that is something that you could potentially do, that the health department could do for the county, correct? Is that something that's being considered, being discussed as, if it gets bad enough, will we do it?
Well, again, a couple things. You're going to have to really look at what's happening in the community, how it's being spread, the levels for any type of mandate whatsoever. We worked with the city last year on their mask mandate. We did the same thing this year with any of the cities that want to. The real issue is, again, what is the benefit of mask mandate? How are you going to enforce it? So that there's still a lot of those things that we're still going to deal with in the coming weeks to months, if that is the case. I think really the bottom line, the message here is that, again, we're going to ask the community to, again, use personal responsibility about wearing masks, about getting vaccinated. It really is up to us as individuals to protect ourselves and our families and our community. And it might mean having to, again, wear a mask. It might have to be get vaccinated. It might have to be, do things that, again, we may not want to, but those recommendations are out there, and it's going to be up to me and you and everybody else to make sure that we're doing the right things for us to not spread the disease.
The last question comes from Zipporah Price. Zipporah, if you would like to ask your question, please do so now.
Yes, hi. Thank you so much for allowing me to ask my question. It has to do with the incentives that you were kind of talking about. We know that the Vax-A-Million happened, and that was coming straight from the governor. I was wondering if you could kind of talk a little bit more about what those might look like. Would it target the age group, which we saw in the presentation, 20 to 29, which is a younger age group, and very different from what we saw originally with COVID, with older people being at more risk. So if you can just kind of talk about those incentives, and if you'll be specifically targeting the group that is at a greater proportion of hospitalizations and cases right now.
Yeah, thank you. A great question. Not only the age group, but also then too, we're lucky enough that this week we have some new ability to get data, really diving down into our community where we might be lacking in vaccinations. And again, our underserved population is always a concern. We have the ability to dive a little bit deeper into that data to see, okay, exactly where we might need to go. And we're looking to plan on that as well. Any incentives, of course, would hopefully be, aligned with that age group. We have some possibilities of, like gift cards. I know that we're working with other entities that want to do vaccination clinics that could bring in those age groups. Relative to state, I would imagine they're going to go ahead and look at something a little bit bigger than, just gift cards. However, I think it's important to realize too that the state government has really worked hard to figure out anything it possibly can to help us locally offer incentives or do our jobs. And so that ability to be able to offer incentives really has, started with the Ohio Department of Health, the governor's office, and really trickled down to us. And again, we don't quite know how that's going to look like. We don't know how long it's going to run, but we do know that we need to figure out any type of avenue, any way to reach those age groups to say, hey, listen, if you're on the fence, get all the information you possibly can. Call us, call your doctor, get reputable information to get vaccinated, make that decision. And if it's just something, I'm not quite ready yet, but if it's something that we can put out there to say, okay, this will make your life a little bit easier to get vaccinated. Let's do that. And we'll try anything we possibly can. Thank you. Awesome question.
That concludes our questions, Eric.
Thank you so much, everybody. I'm sure more to come over the next weeks relative to the Delta variant and also the vaccination rate. Again, wanted to make sure that we got the message out to the community about where we're at right now and where we might go, with the understanding that, you know, we're going to have to keep a close eye on all that data that we have and making sure that the community understands where we're at that point in time. So again, I thank everybody and I appreciate what you do and getting the message out.